All right, so for the past few lessons, we've really been diving deep into the science of nutrition for older adults, right? We've even talked about how it connects to really complex conditions like dementia. But here's the thing. All that amazing science doesn't mean much if people can't actually get the food they need. So in this explainer, we're going to talk about that final crucial piece of the puzzle, the very real barrier known as food insecurity. So let's kick things off with this big number right here, 96%. What do you think that is? Well, that is the percentage of older Americans who say they want to age in place. That means living in their own homes, in their own communities, for as long as they possibly can. And you can understand why. This really sets the stage for our whole conversation because it shows why community-based nutrition is just so incredibly important for healthy aging. Now, it's super important that we're all on the same page about what food insecurity really means. This isn't just about feeling hungry for a little while. The key here is the vulnerability. It's that constant, nagging worry about where your next meal is coming from. It's the stress of having a fixed income and watching grocery prices go up. It's a persistent economic and social problem, not just a physical feeling. And the scale of this problem? It is absolutely staggering. Just in the United States, we're talking about over 15 million adults over the age of 65 who are considered economically insecure. That means their income puts them at a super high risk for the exact kind of food insecurity we just defined. So this isn't some small niche issue, it is a massive public health challenge. So what happens when an older adult is dealing with this kind of insecurity? Well, it's way more than just being uncomfortable. It actually kicks off what we call a dangerous physiological cascade. Think of it like a downward spiral, where one health problem leads to another, and it just gets harder and harder to pull out of it. Let's break down what that cascade actually looks like. Okay, first up, any chronic conditions they already have, they get worse. I mean, just imagine trying to manage type 2 diabetes when you can't afford fresh vegetables or lean protein, and you have to rely on cheap processed foods. Or trying to get your hypertension under control when your only affordable options are loaded with sodium. Poor nutrition doesn't just stop you from getting better, it's like pouring gasoline on the fire. Next in this domino effect is a decline in physical function. You know, when older adults don't get enough protein, don't get enough calories, it speeds up sarcopenia, that age-related muscle loss we've talked about before. And that directly leads to trouble getting around, a much higher risk of a really bad fall, and a loss of the very independence they're trying so hard to hold on to. And this third consequence, it ties directly back to what we just covered on dementia. When you combine nutrient deficiencies, like not getting enough vitamin B12, with the incredible psychological stress of just worrying about food all the time, it can directly mess with memory, reasoning, and overall brain function. It basically creates a perfect storm that can make cognitive decline worse or even mimic its symptoms. So, with this really dangerous cascade of problems, what's the answer? This quote right here really nails it. We have two choices. We can either wait until people get so sick they end up in a hospital or a nursing home, or we can step in and help them in their community. And the evidence is crystal clear. Supporting people where they actually live is better for them, and honestly, it's way cheaper for the entire healthcare system. So what does that support actually look like on the ground? Well, it's not just one thing. It's a whole bunch of services working together. You've got nutrition education, helping people make healthier choices on a tight budget. There's medical nutrition therapy, where a dietitian helps manage those chronic diseases. For folks who can't get out easily, meal delivery services, like Meals on Wheels, are a literal lifeline. And then you have congregate meals, which aren't just about the food. They're about getting out and socializing, fighting off that loneliness and isolation. Now, what I think is really cool is how we measure if these programs are actually working. It's so much more than just, did we hand out food? The goals are way bigger. On a nutritional level, yeah, it's about reducing hunger with good food. Physiologically, it's about stopping that muscle wasting we talked about. Socially, it's about bringing people together. And from an economic standpoint, the goal is to keep people out of the hospital and help them avoid needing expensive nursing home care. It's a whole-person view of what health really is. And that just about wraps up our chapter on nutrition for older adults. We've covered the science, and now we've seen how critical access really is. We have these amazing systems in place to get nutritious food to the people who need it most. But this all leads to one final, really important question that's going to take us right into the last chapter of our course. Once that food gets there, how do we make sure it's not just nutritious, but actually safe to eat?